Liver function tests. Biochemical tests for diagnosis and monitoring of liver diseases are referred as liver function tests. Tests were classified on major functions of liver: excretion of bile acids, bromosulfur, sulfasin, bile pigments, etc., metabolism of carbohydrates and amino acids, synthesis of serum proteins, detoxification of ammonia and hippuric acid synthesis, serum enzymes as markers. But nowadays, LFTs are broadly classified as to detect hepatic injury, whether mild or severe, acute or chronic, nature of injury, hepatocellular or cholestasis, test to assess hepatic function, function of liver, synthesis function, metabolic function, detoxification, excretory, homeostatic, storage, production of bile salts, helps in digestion of fat, emulsification. Synthetic functions: synthesis of plasma proteins, albumin, coagulation factors, many globulins, synthesis of cholesterol, synthesis of triacylglycerol, lipoprotein synthesis, metabolic function, carbohydrates, glycolysis, glycogen synthesis, glycogen breakdown, gluconeogenesis, ketogenesis, fatty acid synthesis and breakdown, protein catabolism, citric acid cycle, production of ATP, detoxification and excretion, ammonia to urea, bilirubin, bile pigments, cholesterol, drugs, metabolites, homeostasis, blood glucose regulation, storage function, vitamin A, D, K, and B12, production of bile salts, helps in digestion. Classification of liver function test based on laboratory findings. 1 minute. Based on laboratory function test, based on laboratory findings, group 1, test based on liver excretory function, serum bilirubin, Van de Borg reaction, serum bilirubin, icteric index, urine bilirubin and bile salts, urobilinogen and fecal stercobilinogen, urine urobilin and fecal stercobilin. Liver enzymes panel test, biomarkers for liver injury and cholestasis, alkaline phosphatase, serum glutamate pyruvate transaminase SGPT or ALT, serum glutamate oxalate transaminase SGOT or AST, gamma glutamyl transferase GGT, serum isocitrate dehydrogenase, choline esterase 5 nucleotidase. Group 2, test for synthesis function of liver, plasma proteins, total proteins, serum albumin, globulin, A upon G ratio, prothrombin time, flocculation test, amino acids in bloods and urine, fibrinogen concentration. Group 4, specific function test, alpha 1 antitrypsin, alpha fetoprotein, ceruloplasmin and ferritin. Based on clinical aspects. Group 1 for liver dysfunction, serum bilirubin, serum total protein, albumin, serum A albumin upon globulin ratio, which is normally 1.7, urine urobilin, urine bilirubin, urine urobilinogen and fecal stercobilinogen, urine urobilin, prothrombin time, blood ammonia. Group 2 markers, SGPT or SGPT and SGOT. SGPT is also called, here you can see, SGPT is also called ALT and SGOT is called AST. Okay, SGPT is ALT and SGOT is AST. So, summary of all this is classification of liver function tests. Classification based on laboratory findings. Group 1, test of hepatic or excretory function, serum bilirubin, total, conjugated and unconjugated, urine, bile pigments, bile salts and urobilinogen. Group 2, liver enzymes panel. These are markers of liver injury and other cholestasis: alanine aminotransferase ALT, aspartate aminotransferase AST, alkaline phosphatase ALP, gamma glutamyl transferase GGT. Group 3 plasma proteins. Synthesis function of liver, total protein, serum albumin, globulin, A upon G ratio, prothrombin time. Special test ceruloplasmin, ferritin, alpha 1 antitrypsin, alpha fetoprotein, classification based on clinical aspects, markers of liver dysfunction, serum bilirubin, total conjugated urine, bile pigments, bile salts, and urobilinogen, total protein, serum albumin, and A upon G ratio, prothrombin time, blood ammonia when indicated. Group 2 markers of hepatocellular injury, alanine aminotransferase ALT, aspartate aminotransferase AST, markers of cholestasis, alkaline phosphatase, gamma glutamyl transferases. Group 3 for cholestasis ALP, alkaline phosphatase, gamma glutamyl transferase GGT. Indications of LFT, jaundice, suspected liver metastasis, alcoholic liver disease, any undiagnosed chronic illness, annual checkup of diabetes patients, coagulation disorder, therapy with statins to check hypertoxicity. Jaundice overview. Urinary findings in jaundice, prehepatic or hemolytic jaundice, bile pigments are nil, bile salts nil, urobilinogen present, hepatocellular, normal urobilinogen, posthepatic or obstructive, bile pigments present, bile salts present, but urobilinogen is absent. Classification of jaundice. Unconjugated types of bilirubin. Unconjugated type of jaundice, prehepatic or hemolytic jaundice, causes are abnormal red cells, antibodies, drugs and toxins, thalassemias, hemoglobinopathies, Gilbert syndrome, Crigler-Najjar syndrome. Unconjugated and conjugated are raised in hepatic or hepatocellular, viral hepatitis, toxic hepatitis, intrahepatic cholestasis. Conjugated or obstructive, posthepatic. Extrahepatic cholestasis, gallstones, tumors of bile duct, carcinoma of pancreas, lymph node enlargement in porta hepatis. Test useful to distinguish different types of jaundice. Blood test, unconjugated bilirubin, Van de Berg indirect test, conjugated bilirubin, Van de Berg direct test, alkaline phosphatases. Prehepatic or hemolytic retention jaundice, hepatocellular jaundice, and posthepatic obstructive or regurgitation jaundice. Urine. Bile salts, Hayes test, conjugated bilirubin, Fauchert's, urobilinogen, Ehrlich test, feces, urobilins. Increased in early cholestatic phase, absent, later decreases as production is low. Earliest manifestation of recovery is presence of bilinogen in urine. Overview of liver function test. Serum albumin in chronic liver diseases. Serum globulins increases in chronic hepatitis. Prothrombin time prolonged in liver diseases. Prothrombin time plus vitamin K prolonged in hepatocellular if PT normal cholestasis, alpha fetoprotein increased in carcinoma, ceruloplasmin decrease in Wilson disease, Menkes disease, transthyretin to assess nutritional status, alpha 1 antitrypsin decreases in neonatal cholestasis, progressive juvenile cirrhosis, micronodular cirrhosis, hepatoglobulin transferrin, severe hepatocellular disease cirrhosis, lipoprotein X increased in cholestasis, galactose, half-life greater than 12 minutes, intolerance test cirrhosis, infective hepatitis. Amino acid, increased aromatic amino acid, branched chain amino acids in hepatic coma, both increased in cirrhosis. Plasma bile acid, postprandial rise in hepatic dysfunction, increased fasting level in post-systemic shunting. Urine bile salts, positive in post-hepatic jaundice and hepatic jaundice. Ammonia, increased in cirrhosis post portocaval anastomosis. Transaminases, viral hepatitis, ALT and AST increase, chronic active hepatitis N or slight increase, cholestasis slight increase, alcoholic hepatitis ALT AST ratio reversed, ALP increased in cholestasis, GGT increased in cholestasis. Thank you. Go and download my notes.